Hang in there, Nyan. We'll be at the hospital soon. Ma'am, is your child not feeling well? He looks really pale. Yeah, he's physically weak. He's sensitive to inner energy during the noon break. There's too much chaotic energy on the bus. It's making his chest hurt. Hold him tight. Try to avoid seats with strong energy fluctuations, that'll help. Is anyone here trained in inner energy regulation during noon break? Quick, help. This gentleman's inner energy is reversing. Everyone, make way. I'm trained in noon break inner energy regulation. Please help lay the gentleman flat. Don't move him. It's acute inner energy reversal. The shock's affecting his internal organs. We need to regulate it immediately. Hey. He fell during sudden braking, causing inner energy reversal. I've done basic energy regulation. He needs professional equipment for further treatment. Emergency inner energy rescue complete, awarded 50,000 yuan. Continue with energy diagnosis. Is this an auditory hallucination? Can't find the HR department. You're new here too. I've been searching for over 10 minutes. You guys must be the new ones, right? Welcome aboard. You guys have been assigned to the ICU Severe Inner Energy Disorder Department. Director Shan, can we be transferred to the General Regulation Department? ICU is tough, but really hones your skills. First, check in with the resident instructor. You stay behind. You were personally requested by Director Zhao of ICU. He reviewed your profile. He said your basic inner energy control is outstanding. Your emergency response is strong. You're highly trainable. Director Zhao named you directly. I was pretty average in med school, and my noon break skills are only average. Work hard. Don't let everyone down. System, are you there? Hello, host. The High Marshal Support System has been activated. You can communicate with me through your mind. Check your panel for skills and tasks. The ultimate inner energy diagnostic skill was your reward. Check my personal panel. My score is so low. 27 points lower than the DJ noon break average. But my system skills are far above standard level. Activation will rapidly boost your abilities. That's amazing. With this skill, I can easily handle critical patients and raise my noon break proficiency. I'll make full use of this skill and work hard to improve. Do a good job in the ICU, not let Director Zhao down, and become an advanced martial healer. The weapon energy concentration here is way higher than in other hospitals. Even the protective panels have formations to stabilize energy. No matter how skilled, it's useless. We're just here for odd jobs. I heard all the mentors in High Martial. I see you are extremely strict. We're probably not getting hands-on with real treatments. A total waste of our 5 meridian talent. I'm the ICU director. You must be the new interns. First rotation for the 5-1 batch. Director Zhao. High Martial ICU and regular ICU are different. Here, the core is using weapon energy to sense the 5 meridians and life force state of patients. All the patients here have chaotic weapon energy. They're martial artists with 5 meridian injuries. Follow the young man in white with a stand-up collar to get oriented. He's your mentor. Learn from him carefully. Come with me. I'll show you around. We'll assign tasks after. This is the critical care ward. Each room has a weapon energy regulation pod and a high martial life monitor. Today's job for you is to organize these high martial case files. They record the cases of martial artists' weapon illnesses. I've wasted half my life here. Told you so. Turns out we're just doing grunt work. Sorting files is such repetitive busy work. Does nothing to boost our weapon energy skills. A total waste of time. Wu Yi, come here quick. Bed 3 patient has a sudden complication. Ah, 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 ah. Patient's weapon energy is crashing. His blood pressure's plummeting. Possible drug reaction fast. Someone help. Short-haired nurse. Prepare high-purity adrenaline for DJ weapon fusion. Prepare a weapon stabilizer too. Help stabilize the patient's chaotic weapon energy. Prevent damage to the 5 meridians. Thank goodness you're here. All thanks to this intern. Their response was super quick. The patient's stable now. Vitals have returned to normal. The patient's weapon energy is basically stable. Adrenaline and weapon stabilizer take effect. Avoided another weapon energy reversal. Well done. We have a tracheal intubation surgery this afternoon. You'll need to use weapon energy for precise control. Avoid injuring the patient's 5 meridians. Come observe and learn with me. Thank you, doctor. I'll make sure to study hard. Weapon energy flow is blocked due to lung infection, resulting in respiratory failure. Tracheal intubation is needed, along with mechanical ventilation and energy infusion, to keep vital signs stable. Hi, Marshall. The key in tracheal intubation is to use weapon energy to wrap the laryngoscope and skillfully avoid affected areas, especially the central 5 meridian and lung nodes in the neck. I'll demonstrate in a moment. Observe closely, especially the power and angle of energy control. Not working, can't position for intubation. Let's try again. Shifting to kidney meridian will weaken it. Dr. Sun asked me to give it a shot. I can precisely control the energy through meridians 1 to 5. Adjust the angle of the laryngoscope. Avoid the patient's chaotic weapon energy clusters and the key 5 meridian nodes. That should make the intubation successful. Try it, but be careful. Precise control. Weapon energy is like a doctor's hands. I'll be careful. Well done. Your weapon energy control is precise with zero risk. All thanks to the Blue Hat Doctor's mentorship. I was just doing my job. Was the surgery a success? Director, the operation went smoothly. But there was a complication during the process. The patient had abnormal oral anatomy and chaotic weapon energy. I attempted intubation multiple times, but couldn't succeed. This intern has impressive talent. Meridians 1 to 5 controlled accurately. Stayed calm under pressure. Judgment was spot on. Both in this morning's emergency and this afternoon's surgery, their performance is well above an average newcomer, almost on par with mid-level 5-1 doctors. I suggest giving him more hands-on opportunities in the future and prioritize his training. Well done, you didn't let me down. High martial medicine requires both medical skills and proficiency with weapon energy, especially the ability to stay calm in a crisis. You demonstrated all that today. Go learn well from the doctor in blue. Get lots of practice, and strive to become a qualified high martial doctor as soon as possible. Thank you, Director. Thank you, Doctor. I'll study hard, keep refining my control over meridians 1 to 5, and do my best with every treatment.
Today,
When you performed energy flow regulation on that severely injured dancer, your control was unbelievably precise. I saw that Professor Sun nodded at you. How on earth did you do it? I practiced for half a month. I still couldn't even do the basic key and blood venipuncture right. Either I used too much force, which would damage the practitioner's meridians. There's really no secret to it. It's all about martial arts. I interned at an off-campus martial healer hospital. After a while, as I encountered more cases and got enough hands-on practice, I naturally became more proficient. For us, May 1st, it's all about touch and experience. Of course, I can't say I have system assistance. The existence of the system is too unusual. If it's exposed, it could bring trouble. So I just use the internship as an excuse. Actually, I was sent here by my family to train. My family does business with martial arts equipment. My parents hope I learn something about martial arts, so I can help the family in the future. But I never really practiced much as a kid. My martial arts basics are too weak, and my healing skills are a total mess. I promise I'll study hard. I won't waste your time. No problem, we're all colleagues. It's only right to help each other out. Let's start right from the basics. We'll begin with practitioner's venous key and blood regulation. First, work on breathing control. Then move to hands-on practice. Host detected. Basic martial medical skills teaching will begin soon. Skill impartation mission launching. Mission requirements. Successfully teach the blue-clad, short-haired young man to master basic martial medical skills. Alright, let's get started then. First, sense your own DJ martial aura. Gently guide it to your fingertips. Remember, keep your breathing steady. Don't get impatient. Relax your wrists. Keep your aura stable. That's right, take it slow. Watch my demonstration. Just like this. Try again. I did it. I really did it. I finally mastered the essentials of venous instrument puncture. Mission complete. 2,500 received. Points have been credited to the host system panel. They can be exchanged for items at any time. Not bad, you improved really fast. As long as you keep at it, you'll definitely become a qualified martial healer. I won't let your guidance go to waste. Host May 1st skill rating has reached 31 points. Unlocking advanced martial arts healing simulation function. You can enter the virtual scenario now. Let's start with this one. Solidify your basics so you can handle more complex injuries. Don't you feel like everyone's looking at you a little strangely? Like they're all talking about you. Yeah, it does feel like that. Let's go ask around. Hey, did you hear? Last night, Director Zhao and the chief surgeon almost got into a fight over the guy in the white coat with short hair. They nearly argued over him. Let me tell you a secret. That black-haired, white-coated teenager is especially skilled at ki regulation and trauma healing. But the critical care director insists on keeping him. They want him to stay in the ICU. This reagent is unstable. It could explode at any time. I tested it, the concentration is way too high. It could go out of control. The professor is waiting on the results. What do we do? Quiet, fall back for now. Find a safe place. A high-level May 1st is a hot commodity no matter the group. Yeah, I really didn't expect you'd be in such demand. Both Director Zhao and the chief surgeon want you. Just focus on doing your own job well. First, let me introduce an old friend. ICU medical team leader. Stern-faced, short-haired guy. He's the top May 1st practitioner. Next, you'll be learning from the stern-faced, short-haired guy. Be sure to consult him a lot. Looking forward to working with you. You'll all be following me for further training. Don't slack off. Now let's focus our discussion on a healing plan for a critically ill patient. This patient is a high-level martial practitioner. He suffered multiple organ failure due to a failed martial arts breakthrough. His ki and blood are severely disordered. His vital signs are currently unstable. Based on your experiences, let's hear everyone's thoughts. Since you're a high-level martial healer, let me ask you, when a practitioner suffers ki and blood disorder after a failed breakthrough, how do you evaluate it? Ki chaos due to a failed breakthrough is mainly about reverse flow and blocked meridians. You first use DJ ki regulation technique to unblock the meridian. Then use focus pills to stabilize their aura to prevent further ki reversal. As for hidden wounds, use a ki and blood scanner to examine the meridians. Combine the practitioner's pain feedback and focus on abdominal meridian nodes. Those spots are especially likely to have hidden injuries. Also, I suggest while regulating ki, using a small amount of healing rune to speed up meridian recovery and improve healing efficiency. Prepare the advanced hemostatic healing technique quickly. Inject the ki and blood stabilization drug. Monitor the patient's ki and blood changes. The patient's situation is critical. Stop the bleeding now. Blood pressure is still dropping. Connect the equipment. Prepare to begin. Heart rate is unstable. Alarm upgrade. Hang in there. It will take effect soon. Go. Wait a second, team leader. The patient's pupils are uneven. Could be ki reversal, leading to intracranial bleeding. This is a common critical complication after breakthrough failure. Intracranial hemorrhage. No way. The patient was just suffering from ki and blood disorder. How did it suddenly become an intracranial bleed? The short-haired guy has a point. Martial practitioner's ki reversal makes intracranial hemorrhage highly likely. We can't be careless. Order an emergency martial arts CT scan immediately. Contact neuromartial surgery. Prepare for emergency surgery. Cranial surgery required. Key and blood regulation. We must save the patient's life. Contact neuro level 5 surgery. Prepare for cranial surgery. Make sure the patient pulls through safely. Quick, their vitals are dropping. Understood, accelerating. Get room B ready. Notify the doctor. Access route is clear. Just transferred from the Marshall emergency room. Been pulling all-nighters working on blueprints. Hasn't slept for 3 days straight. Suddenly collapsed yesterday. Brought in as an emergency. Dr. Zhang, this is the initial key and blood test report for the patient. Doctor, please save my son. He just worked too hard. He never should have pushed himself like this. Yes, doctor, if you have any ways to help, we'll do whatever it takes. Don't worry. We'll do our very best. I understand the patient's situation now. Team Leader N, there might be an issue with that plan. Dr. Zhang, I'll do the first group's hepatic meridian core points. What's wrong with that? Maybe he caught something in the diagnosis, a detail missed by the whole hospital. What's going on? How is the patient now?
Director.
The patient's suffering from acute hepatic meridian failure due to overexertion. I've already prescribed it. The doctor says my plan is wrong. You have a different opinion? Director, this is the latest test result. The potassium and sodium levels here are abnormal. Let me check. He often lowers his head due to residual toxic gas from 1 to 5 oxygen lines. He often performs top-level diagnostic techniques. The test shows it's not just simple depletion of vital energy and blood. There are components that could damage the liver vessels. The young man in the white coat is right. Just now I sensed the patient's liver vessel energy. There really is a strange, stagnant feeling. It's not just exhaustion. Call the chief. This is too risky. We've never targeted this kind of health supplement before. Liver vessel failure triggered by toxicity. If anything goes wrong, activate the demonic threshold. Then use the standard protocol. It will only waste time. We just trust him. Arrange 5 rounds of plasma exchange therapy. Quickly clear the toxic energy and blood from his body. Begin the procedure, understood? Auntie, the patient's condition is very critical. Next, the risk of irreversibility has already appeared. We need you to sign the No Doctor Treatment Consent form. We'll use every resource available. Do our utmost to save him. We'll sign. As long as our son can be saved. We're willing to do anything. Please, we're begging you. Doctor in the white coat. The patient's liver vessel and blood concentration are slowly increasing. But the blood ammonia index and coagulation related vital energy and blood indicators are still declining. At this rate, in another hour, there's a high chance he'll develop hepatic encephalopathy. It's urgent. The patient is about to develop hepatic encephalopathy. I recommend immediate use of the 5-stage molecular adsorption and recirculation system. It can quickly process the toxins in the body. Figure 4. Stabilizing liver vessel energy and blood. Dr. Zhang, the Mars system is indeed effective. But the hospital's machine is currently in advanced maintenance. The technician said it'll be ready by tomorrow. Right now, it's not usable at all. Yeah, without the Mars system, it's hard to accurately clear this toxic energy and blood. We'll use continuous energy blood filtration, with special 5-stage filters as a temporary substitute. Though the filtration isn't as good as the Mars system, it can temporarily stabilize the liver vessel's energy and blood. It buys time for the maintenance. No, absolutely not. CRT with special 5-stage filters is an unconventional therapy. It has not undergone reverse flow through the patient's energy and blood. It will further worsen the liver vessel damage. The risk is too high. I don't agree. Team leader Anne, the doctor in the white coat's diagnostic skills have never been wrong. If he's confident enough to suggest this plan, he must be sure about it. We can't just sit back and wait. You're just a martial arts apprentice. What do you understand about medicine? Treatments need to progress step by step, no rash actions. Using unconventional methods. Who's responsible if something goes wrong? Dr. Zhang. Is your plan feasible?
Director Bay.
I've simulated it countless times in the system. This plan can temporarily stabilize the flow of vital energy and blood. Combining it with 5 medicine regimen can minimize risks. I'm willing to supervise the whole process. If anything goes wrong, I'll take responsibility. If you don't trust him, then you're gambling. Assist the short-haired doctor in the white coat to supervise the treatment. Blood pressure is dropping. If this continues, the patient could be at risk. Stop the treatment immediately. Don't stop. This isn't a treatment error. It's a normal response to the 5-way key and blood filtration therapy. The toxic energy and blood inside are being filtered. Key and blood fluctuations are slowing down. Blood flow rate is stable, Feng. It's really stabilized. Doctor, thank you. Thank you for saving my son. This is our duty. The patient's vital energy and blood are temporarily stable, but we need to closely monitor them going forward. Liver meridian repair takes time. Well done. This time it's all thanks to you. Otherwise, the patient might have been in real danger. I was too stubborn. Thank you for reminding me. And thank you for saving the patient. We're all here for the patient. Doctor with black hair. The patient's internal energy is still very chaotic. The liver meridian blockage hasn't improved. The energy index remains on the verge. His meridians were already damaged due to impact during foundation building stage. Monitor the energy fluctuations closely. Notify me immediately if there's any abnormality. Oh no, cheers. Defensive mentality 10,000. Get ready to clear it fast. Set efficiency to max. Copy that, adjusting parameters on the energy purification device. The 5-calm sedation regimen is ready. The patient's mind has stabilized a bit. Keep increasing the energy purification intensity. Don't stop. My child. What's wrong with him? Doctor, please save him. He can't be in danger. Honey, calm down. The martial healers are doing their best. We have to trust them. It's stabilized. I'll step out and explain. Doctor, how is my son doing? Please stay calm. We're doing everything we can. Is there anything we can do? Doctor, how is my son doing? Is he in critical condition? Those tubes all over him. He must be suffering so much. The 5-calm sedation has suppressed his agitation. The energy purification device is also working to clear out residual energy and toxins from his body. These energy lines are for monitoring his internal state and liver meridians and facilitate healing. They're all essential. Aunt, uncle, even though he seems unconscious now, you can try talking to him. He can sense the warmth of his loved ones. Connect with him. Maybe it'll give him strength. Help him stabilize his consciousness. Meyer, Mom's here to see you. Your mom's only child. Mom and Dad have given everything for your cultivation. When you get better, our family will live a good life together. Young doctor in white coat. I used to say this place is a battlefield. Now you probably understand, right? The longer we hold on, the more hope the patient has. I get it, we must hold on. Protect this family. The advanced energy repair device was prepped ahead of schedule, 2 hours earlier than expected. We can switch treatment methods now. That's great. Thank you for your hard work. Let's start right now. I'll handle dual guide internal suction. You operate the repair device? Let's work in sync. I was too stubborn with my views before. I overlooked the deep-rooted causes of the internal chaos. If you hadn't suppressed his 5-fold energy disturbance in time, we might not have made it until the repair device arrived. It's all for saving the patient. No need to mention the past. Let's keep going. We must get him out of danger. No need, team leader. I'll stay a bit longer. I want to keep monitoring his energy fluctuations to ensure no setbacks during treatment. We can't afford any mistakes. Alright, then let's watch over him together. From now on, we'll discuss ICU matters together. No more stubbornness. Dr. Zhang's been nurturing the internal energy all night. Son, hurry and eat while it's hot. To replenish your energy. Doctor, this is for your nourishment. No need to be so polite, sir. It's my duty. You've worked so hard. Dr. Zhang, to tell you the truth, my Minner is exceptional. He used to be the champion of the energy design competition at Martial Arts Academy. Especially good at integrating energy with equipment. Never thought something like this would happen. Don't worry, sir. The young man in the bed is a gifted dancer. We'll do everything we can to save him. Team leader, black-haired doctor. The patient's awake. Energy index is back to normal. Liver meridian blockage has basically cleared. Lung energy has also been fully purified. How are you feeling? Any discomfort anywhere? Much better, thank you, doctor. I'm fine now, thank you, doctor. Thank you all for saving me. Good job this time. It was all thanks to your accurate judgment and persistence throughout the process. You not only saved a key young patient in our ICU. I'm proud of you. Thank you, Director. This isn't just my achievement. It's the result of the whole team's efforts. As long as he fully recovers, all our efforts are worth it. Thank you, thank you. Thank you for saving me. No need to thank me. I'm happy you woke up. The most important thing now is to rest well, don't strain yourself. This time was because you trained with uncertified low-quality powers. The practice caused chaotic abilities and damaged your meridians. From now on, be sure to stay away from illegal cultivation resources, or you may never cultivate again. Sorry, before this I was jealous of your talent. Felt you were so young but already had high-level healing powers, so I was biased against you. Even questioned your skills privately. I apologize to you. In these last 48 hours, I've seen you push through despite draining your own abilities, and persist the whole time, accurately controlling your healing powers to repair the young patient's damaged meridians. I'm truly impressed by your professionalism and dedication. It's all right, we're all colleagues. Let's work together from now on. The ability medicine department needs everyone working together to handle things. Very good. This is exactly what our ability medicine department should look like. We're dealing with critically ill abilities users. Every treatment is a matter of life and death. Only by close cooperation, letting go of prejudice, can we maximize saving lives? Thank you for saving my son. If not for you, my son would have been totally ruined. You're a savior to our family. Absolutely. Dr. Zhang, words can't express our gratitude. If you ever need anything, we'd go through fire and water for you. Dr. Zhang, you're so capable at such a young age. And you're kind too. We don't have a son either, so why not treat you as our own? Thank you, Auntie, for your kindness. I appreciate it. Being able to save the black-haired boy in the hospital bed makes me really happy too. Notification: host detected. Successfully treated a critically ill ability user. Completed team-based rescue mission. The reward this time is less compared to solo missions. I know more than the reward. I care more about the hands-on experience I gained this time, and the recognition from my colleagues. These mean more than money or skills. How's Zhang Ming doing? He finally made it, right? You haven't slept in 48 hours. You can finally take a break. Yeah, I'm already awake. Your ability fluctuations and meridian state are both stable. You're fine now. Freshen up and come with me for lunch. There's something important I need to tell you. Go eat at the Ability Warden's cafeteria yourself. We're heading out first. Okay, Director. You guys go ahead. The talent gap is getting bigger and bigger. White coat, Director. White coat, young man. Come over and have a seat. Let me introduce you all. This is the captain of our Ability Wardens. He's also one of the senior administrators in the city's ability community. Hello, Captain. I'm Zhang Feng from the Ability Medical Department. I've heard about you. You're already a high-level healing type ability user at your age. You successfully treated someone with meridian injuries this time, and brought an ability disorder patient back. You did very well. Thank you for your recognition, Captain. I will do my best to excel at my job, and not let you and the director down. I've invited you here today to make an important announcement. The National Ability Medical and Combat Integration Competition is about to begin. We need to select 3 ability users to participate. As for candidates from our department, the most suitable one lacks experience. But data shows he's the best. Still, that's not enough. He needs to be versatile. We support your choice. Let's hear everyone's opinions. I recommend the white coat young man. Not only is he a high-level healing type user, but his meridian suturing skills are excellent. His precision far surpasses others at his level. He's totally up to the task. Yeah. Then before the official competition, within our ability wardens team, let's do a trial contest first. Short-haired young man, you're a promising talent. Gifted, responsible, and you understand teamwork. I've already been training you as my successor. I want to keep developing you. Keep working hard from now on. Director, that's really too much praise. I still have a lot to learn. I definitely won't let you down. You had lunch with the director today. What did you talk about? What's really going on? Tell me already. The director brought up the National Medical Friendship Competition and wants me to represent the hospital. Some kind of national competition? You've only been in our department 3 days. I thought it'd be like every year, and they'd send medical team leader NZ. He's an ultimate healing type user. What exactly is the competition about? Are there any rewards? Will there be an hospital selection round first? Let's do our rounds first. I have an announcement for everyone. Director Lee wants the short-haired white coat guy to represent our hospital in the National Medical Ability Competition. Hello, I'm Zhang Feng from the Ability Medical Department. I've heard about you. You're already a high-level healing type ability user at your age. You successfully treated someone with injured meridians this time, and an ability disorder patient. You did great. Thank you for your recognition, Captain. I'll do my best at my job. I won't let you and the director down. I gathered everyone today to announce something important. The National Ability Medical and Combat Integration Competition is about to start. We need to pick 3 ability users to join. The most suitable one in our department doesn't have enough experience, but data shows he's the best. Still, we need an all-rounder. We support your decision. Let's hear everyone's thoughts. I suggest the white coat young man. He's not just a high-level healer. He's also amazing at meridian suturing and repairs. His accuracy far surpasses those at his level. He's the perfect choice, really knows his stuff. His top-tier medical achievements. Always spark debate within the team. Then before the official contest, let's hold a trial competition inside the ability wardens. A self-assessment match. Short-haired young man, you're a promising rookie. Talented and responsible. You get teamwork too. I already see you as my successor, and am investing in your growth. Keep working hard. Director, you really give me too much credit. I still have so much to learn. I promise I won't let you down. At lunch today, what did you and the director actually talk about? Nothing much, just work-related stuff. So secretive. I wanted to come too, but you stopped me. Come on, just tell me what happened.
Tell me.
It was nothing. The director just mentioned the National Medical Friendship Competition and wants me to represent the hospital. You're going to represent the hospital in the National Medical Skills Competition. What kind of national competition is this? You've only been in our department for 3 days. Why is it such a surprise all of a sudden? I thought they'd send medical team leader in Z again this year, just like before. He's an ultimate healing type ability user. What's the competition about exactly? Are there any prizes? Will there be an Hin hospital selection? Let's start our rounds. I have some news for everyone. Director Lee wants the short-haired white coat guy to represent our hospital in the National Medical Ability Competition. Detected. Patient with congenital intracranial tumor. Triggered side mission D15. Complete the intracranial tumor resection as lead surgeon. What's wrong? Did you find something? I found the cause of the child's illness. It's not just because of accidentally drinking the wrong medicine. There's a congenital tumor inside their skull. The medicine caused the malignant tumor to flare up. I'd like to request to be lead surgeon for this procedure. No, the high-level imaging is still too blurry. The energy fluctuations are too chaotic. Man in blue and white coat. Contact a medical cultivator from the Divine Essence Department for a consultation immediately. We must identify the source of the brain's abnormal energy as soon as possible. Wait a minute. I might be able to tell what type of lesion it is. All right, tell us. Don't be nervous. If you have any ideas, just share them. The nature of this tumor is that its energy fluctuations are mild, so it's hard to spot. That's why advanced imaging is still blurry. That's a classic feature of these tumors. This kind of hidden energy fluctuation is truly a lot like cross-pattern energy streams. But that's not enough for a diagnosis yet. We have to wait for the Divine Essence Department's expert to do a further consultation. Director Zhao, the situation isn't good. Endoscopic exploration showed, I found, the little girl's energy tumor is in a very dangerous spot. Some of it has already extended to the brain ventricle, right by the Divine Essence core. That's the central hub for the body's energy circulation. The energy channels there are really intricate. Once we try to separate it, the surgery will be extremely difficult. Even a little mistake could damage the core. She could lose her cultivation at best, or lose her life at worst. I know how difficult this surgery is, but either way, we have to give it our all. First, let the Divine Essence Department's expert complete the examination. Then we'll make a detailed surgical plan. Director, the Divine Essence Department's medic is on their way. Should be here in about 10 minutes. How is he? Calm down for now. Deputy Director Hizzy, I'm here. Based on my assessment, endoscopic exploration and the high-energy imaging from earlier, preliminary judgment suggests it is a cerebral energy tumor. Doctor, how much will these examinations cost? And is there any method that doesn't involve surgery? The short-haired little girl is only 8 years old. I'm afraid she can't handle the suffering of surgery. Doctor, we'll listen to you. As long as Xiaomeng can be cured, I'm willing to spend any amount of money. Not good. It's a Shenyuan seizure. He is a new medical cultivator in our ICU. Although he lacks seniority, he is highly talented. His martial arts and medical skills are very solid. Sir, ma'am, please don't worry. Xiaoming's Shenyuan seizure has been controlled. Her vital signs are very stable now. Please rest assured, we will continue to observe her to ensure she recovers fully. But I must be clear with you. Xiaoming's condition is very dangerous. The energy tumor has been continuously compressing the ventricular Shenyuan network. If it continues, it will erode the ocular Shenyuan nodes and even affect the energy circulation of the entire body. I recommend arranging a Wudao detachment surgery as soon as possible. The earlier the surgery, to remove the lesion, the higher the success rate of protecting the Shenyuan core. Yiqiu, what you're saying is incorrect. At present, it hasn't been confirmed by enhanced imaging and Shenyuan resonance. How can you be certain that the energy tumor is already compressing the ventricular Shen-Yuan network? I'm not guessing blindly. Through my endoscopic exploration, I could clearly sense the ventricular Shenyuan network. But regarding the symptomatic Shenyuan seizure, in the end he just brushed the edge of the tumor, near the ventricular area. Notice this main network branch begins to fork here. The turning point is here, connecting to the stimulus branches. This is the critical node. Pressure accumulates, causing the impact to spread. The conclusion is clear. The lesion is here. The young man in white has a point. We can't delay any longer. Immediately arrange a bed for the girl to undergo an enhanced high-object imaging scan and a cranial Shenyuan resonance test. Once we have the results, we will immediately hold a consultation to determine a detailed surgical plan. Thank you. Thank you for saving Xiaomeng. We'll count on you from now on. I will definitely do my best to cure Xiaomeng. Dr. Zhang, making a judgment solely on internal breath exploration, is a bit too hasty. There are many types of spiritual vein blockages. It's impossible to distinguish them precisely by touch alone. We must wait for the spiritual vein angiography and the results of the internal breath tomography before we can confirm the lesion type, to avoid a misdiagnosis. He explored her intracranial spiritual veins with internal breath. There are obvious clogging nodules at the intersection of the spiritual veins. The texture is viscous, and the range of the blockage is not large. There are no signs of spreading for now. I know the internal breath exploration ability of that short-haired young man in the white coat. His judgment makes some sense. But spiritual vein diagnosis is a serious matter, especially regarding the intracranial spiritual veins. Once misdiagnosed, the consequences would be unimaginable. To be safe, it's better to do further examinations first. Take the short-haired girl to the examination room. Arrange for spiritual vein angiography and an internal breath tomography check. Make sure to get the results as soon as possible. Okay, Director Zhao. Don't be afraid, we're going to do a simple checkup. We'll be back soon, okay? Director, I still stand by my point. Internal breath exploration can only serve as a reference, not as the basis for a diagnosis. I understand what you mean. We'll reach a final conclusion once the results are out. Oh. Director Zhao, Dr. Zhang. The test results are out. The spiritual vein angiography clearly shows, at the intersection of the patient's intracranial spiritual veins, There is indeed a colloid-like clogging nodule. It's exactly consistent with the judgment of the black-haired young man in the white coat. Not bad, your internal breath exploration skills have improved again. To accurately judge the lesion type based only on preliminary exploration is quite rare. Young man in white. Based only on internal breath exploration. Your consecutive precise diagnoses are truly impressive. I'll contact neurosurgery for the detachment procedure now. You're too kind. Diagnosis should be cautious by nature. You are also acting in the patient's best interest. As long as the lesion is identified, we just need to treat her as soon as possible. Director Zhao, how is my Zhao Meng doing? Are the test results out? Is everything okay? Ma'am, please don't worry. The test results are out. It's confirmed to be an intracranial lymphatic colloid-like clogging nodule. Although it's a lesion, as long as the lymphatic lesion detachment surgery is performed quickly, it can be completely cured. The prognosis is very good. Then how much will the surgery cost? My husband and our son, which is Zhao Meng's father, is coming over. Sir, the surgical cost is approximately 150,000 yuan. Wait for Zhao Meng's parents to arrive, discuss it, and then make a decision. We will temporarily use spiritual energy potions to stabilize Zhao Meng's condition. There won't be any danger. Doctor, how is my daughter? We rushed here as soon as we got the call. The surgery is very safe. Zhao Meng will be able to recover fully. Please consider whether you agree to the surgery. Young man in the white robe, we agree to the surgery. As long as it can save my daughter, I'm willing to raise any amount of money. Please, you must save her. All right, rest assured. We have already made the arrangements. The surgery is scheduled for 4 p.m. today. He is a high-level martial physician, specializing in spiritual vein lesion detachment surgery. He is very experienced. Black-haired young man in the white robe for Zhao Meng's surgery this afternoon. You may go and observe. Really? Thank you, Director Zhao. Don't get excited too soon. The lead surgeon has a high cultivation level, but he's very arrogant. If I hadn't spoken to him, he wouldn't have agreed to let you in at all. After you go in, you must only focus on watching, no talking, and absolutely no moving around at will, to avoid affecting the surgery, understand? I understand. I will definitely follow the rules. Observe seriously, and never cause any trouble. You're so lucky to actually be able to observe Director Liu's surgery. Yeah, that's right. Director Liu is a high-level martial physician. For his spiritual vein detachment surgery, the rest of us don't even get a chance to observe. You must learn well, and come back to tell us the details. I was just lucky. It's all thanks to the man in the black uniform. I will definitely be diligent. Observe carefully and study hard. Dr. Uncle, I recognize you. You're the uncle who saved me on the bus. Zhao Meng is so smart. You still remember me. Don't be afraid. We're going to the operating room now to finish the surgery. Then your spiritual veins will be clear, and your head won't hurt anymore, okay? Okay, I'll listen to you, Uncle. I'm not afraid of surgery. Zhao Meng is so brave. When the surgery is over, Meng, don't be afraid. Dad and Mom will be right outside waiting for you. You must be strong. Keep it up. Mom, I'm not afraid. The doctor in white will protect me. The surgery will definitely go smoothly. The child's lymphatic colloid-like clogging nodule is benign. As long as the lymph is thoroughly detached, it will be much better than other lymphatic tumors. There won't be any sequelae. Dr. Zhang, we're counting on you. Please take good care of Meng. Sigh. The black-haired young man is a promising talent. His internal breath exploration ability is very strong. This time for Zhao Ming's lesion. He was the one who made the precise judgment first. He won't speak, and he won't cause trouble, rest assured. Since you brought him, then keep him under control. If he affects the surgery even slightly, have him leave immediately. Prepare to start. Pay attention to monitoring the short-haired girl's spiritual vein fluctuations and intracranial spiritual energy pressure. Tell me immediately if there's any abnormality. Yes, Director. Spiritual energy pressure is normal. Spiritual vein fluctuations are stable. Adjusting intracranial spiritual energy pressure. Prepare the spiritual energy probe guide wire. I need to observe the specific condition of the lesion. Preparing for detachment. No, the lesion size. is at least twice as large as shown on the psychic scan. How could this happen? Now it's way beyond what we expected. The man in the white coat's psychic data is abnormal. The psychic pressure of the lesion keeps rising. It's already exceeded the containment level of phase 51. Further probing could trigger a major outbreak. I've been in this field for 30 years, and I've never seen such a stubborn, evil lesion. If we fail, Shaming's spiritual channels will be completely shattered. Doctor in white coat, try adjusting the angle of your psychic probe again. Maybe you'll find a breakthrough. After all, you're our top senior martial medical expert. Is there really no way? I've tried every possible angle. The lesion's psychic pressure is just too fierce. Every time I probe with my inner energy, the precision is there. But when facing such tangled threads, there's just no way to start. Send the psychic scan image to the psychic terminal outside the treatment room and show it to the family. This is beyond what we can handle here. Send her to Imperial Concord Martial Medical Pavilion as soon as possible, or to Tiantin Martial Experts Clinic. There might still be a glimmer of hope. Chief in white coat. Are you sure? This is the toughest case our Martial Medical Center has taken on this year. Giving up just like this, isn't that too much of a shame? There's nothing to regret or not regret. The child's life matters most. We can't risk her spiritual channels and life. Go outside and explain the situation carefully to the family. Be gentle with your words. Meanwhile, contact Concord and Tiantan Martial Medical Pavilions. Get ready for emergency suppression of the lesion when accepting the patient. Okay, Chief in white coat. I'll go right now. Chief, please reconsider. This evil lesion, can our Martial Medical Pavilion really not handle it? We could gather all our senior martial medical experts and discuss possible treatment plans together. Maybe there's still a way. It's no use. I know better than anyone how tricky this lesion is. My endoscope's precision isn't enough. I can't perform accurate separation. The other senior martial doctors are at a similar level to me. So even if we gather everyone, we still might not find a solution. The lesion is tightly wrapped around the underlying muscles and psychic nodes. A single mistake could shatter the girl's spiritual channels. I can't take that responsibility, nor can I risk the child's life. Directors, I can handle this evil lesion. Do you know what you're saying? You have no idea how challenging this lesion is. If anything goes wrong, the consequences would be unimaginable. Doctor with slicked back hair, I'm aware how tricky this lesion is. And I know the consequences if I fail. The consequences would be unimaginable. But I'm confident. With help from my 5E system ability, I can see every detail of the lesion and the spiritual channels, and separate the lesion without damaging the threads or psychic nodes. Give him a chance too. Do you realize how terrifying this evil forbidden's calamity is? The evil force has already invaded the core spiritual source. Separation difficulty is far beyond normal lesion reduction surgeries. You, a young man who doesn't even have senior marshal certification, still dare to volunteer? Your core cultivation can't possibly support such a complex operation. Chief Liu, I understand how dangerous this is. But the evil force inside Shaming is spreading so fast. The top Imperial 5 Virtue Pavilion is hundreds of miles away from here. Dealing with glass-like threads and endoscopic guidance can't be done by courage alone. This level of procedure requires decades of martial medical experience, precise control of the endoscope. If anything happens to the patient, endoscopic hemorrhage could shatter their soul. Can you take that responsibility? The specific treatment plan is to use my own endoscope as a guide to precisely wrap the concurrent lesion at its source and cut off the energy supply to the lesion. The young man's plan is feasible. His thinking is thorough, and it just avoids the core areas of evil force spread. Director Zhao, please give Dr. Zhang a chance. I know he's young, but this is the little girl's only hope. I have no other way left. Fine, I support the young man in the white coat handling the treatment. I will take full responsibility for all consequences. There's no time to hesitate. Young man, the man in the black uniform, and I will assist you. But let me say this first. If the treatment fails, thank you, strict-faced man in the white coat, and you, man in black. I won't let you down, nor will anything happen to the short-haired girl in the bed. Quickly move her to the senior treatment room. You're calmer than I expected. We'll see when it comes to the critical step, whether you can keep it together. For Shaming, I must stay calm. Nurse, adjust the endoscopic microscope to 25x magnification. I need to precisely observe the distribution of the glass threads. Dr. Ryan, but normal observation only needs 10 to 15x. At 25x, your endoscopic control precision requirement will increase exponentially. Are you sure? I'm sure. Only at 25x can I see the fine glass threads clearly and avoid damaging the endoscopic source during removal. The sources wrap this tightly. It's almost unbelievable. It's still growing. Doctor with black hair. The next step, endoscopic circuit grafting, is key. Liu Shu, I can do this. The girl's mother is putting all her hope on me. I can't let a child lose her chance to live. For this trust, I have to succeed. I underestimated you. Next, the man in black and I will use our inner energy to shield you and fully assist your work. Director Zhao, the lesion in this child's brain is extremely stubborn. The lesion is also right next to the brain's blood vessels. So even for a senior martial medical practitioner, it may be impossible to remove it without any damage. Can the doctor with black hair handle this? Don't worry. I've seen the black-haired young doctor's technique. His inner energy purity is extremely high, and his control far exceeds his peers. Give him a little time. Dr. Zhang, the intracranial glass threads are shifting. Keep your endoscopic control stable. I know. All the diseased tissue and attached ventricular lesions have been completely cleared. Not a single blood vessel was damaged. Honey, do you think Meng Meng will be okay? I should have brought her to the hospital sooner. Don't worry. The family can rest assured. The surgery was very successful. The child is out of danger now. As long as proper recovery follows, and the remaining evil energy is cleared from the body, they will gradually recover. Thank you, nurse. Thank you all. Thanks to all the doctors. We're so grateful. The child is finally okay. Thank you all. Doctor, I recognize you. You're the one on the bus last time, who used your energy to stabilize that elderly man having an evil surge. The doctor who stopped the backlash for the old man. Thank you for saving my granddaughter. It's my fault that the treatment was delayed. The child suffered so much because of me. Hey, don't blame yourself. This child's illness could only be cured using advanced martial medical treatment to clear the evil energy. Home remedies are useless. Young man with black hair, your martial medical skills are incredible. Even Jin Yu. Really, your precision is better than many high-level martial doctors. Who did you learn from? It was a senior martial medical practitioner I knew before, plus a lot of diligent practice on my own day and night, training my internal energy hard. My skills gradually became proficient. Who was this hidden master? I do have some connections in the martial medical field. Maybe I know them. That teacher, what happened later? Sorry, Director Liu. That teacher has already passed away. It's not convenient to talk about it more. Seriously, even those who only respect top doctors have been completely convinced by you. Like I said, with your purity and control of internal energy, you'll definitely become a top martial doctor here. There's still a lot to learn, no rush. You're famous now, look. The hospital's martial doctor chat group is blowing up. What happened? Director Liu, I wanted to DM the director and request to transfer you to neurosurgery. But the other directors all want you too. Dude, you're amazing. You even completed a complicated craniocervical surgery perfectly. Now everyone in the hospital wants to know who you are. Teach me Jin Yujin's technique. Start by mastering the basic restrained suturing method first. If you can't suture properly, don't rush to learn the restrained needle. Got it. I'll go practice now. Starting soon. Finally finished the task. Let's see what the reward is for this heart transplant surgery. What's the reward this time? It's a book? Before, didn't I usually go straight into the simulation surgery room? Current host, your theory about heart transplant surgery is still lacking. You don't meet the criteria for direct entry into the simulation. Heart transplant primarily targets advanced congestive heart failure and severe coronary artery disease. There are only 33 hospitals nationwide qualified to perform it. Suzhou no One People's Hospital isn't among them. Looks like this technique is really rare. This system reward is worth its weight in gold. Study hard. So that's it. Theory of accurate coronary artery anastomosis joints. Knowledge check passed. Simulation surgery room unlocked. This simulated task is to independently complete a heart transplant. The patient's condition is stable, but observation is still needed. Thanks for everyone's hard work. Everyone, the latest test results are out. Dr. Zhang, you are really impressive. If someone else handled that critical patient yesterday, there's no way they would have survived. Yeah, you're only 26, and your medical skills are already so advanced. You'll definitely be a backbone of this hospital. Great job. Doctor, not at all. It's everyone's teamwork. Don't be so modest. Thanks. Can I ask you something personal? Are you still single? Are you still single? That's awesome. I know a nurse. She's really pretty, has a great personality, and you'd be perfect together. Should I introduce you? Dark blue undershirt. Doctor, are you trying to set up our black-haired doctor? Stop joking around. I'd rather focus more on my work right now. Ren, you're looking great today. Yeah, work's been going well lately, huh? How's Sha Li's prep going? All right, that's enough. Stop teasing the young black-haired doctor. Really, you're 26 this year. It's really time to start dating. Don't focus all your energy on work. How are your speeches coming along? The hospital-wide meeting is next Monday, so don't slack off. I've got a first draft done already, and revised it twice. Please take a look. You know, I'm almost done preparing, mainly sharing the process of treating the last critical patient, along with some professional insights. You've performed very well recently. Both your skills and adaptability stand out. Have you considered transferring to neurosurgery or cardiac surgery? You could make better use of your talents there. Thank you for your recognition, Director. Honestly, I prefer working in the ICU. Here, I get to encounter different critical cases every day and learn how to save lives directly. Well, since you like the ICU, do your best in the ICU. I have high hopes for you. Thanks, Director. Thank you, Director. You're famous now. When you talked about being single today, your photo went viral in all the department groups. Uh, it's not a big deal. Is it really that exaggerated? This is a big deal. There are lots of single ladies in our hospital. And as soon as your photo came out, there's a mixer dinner tonight. Some friends and several nurses from general surgery will all be there. Come on, don't hesitate. Everyone's waiting for you. Come join us and have some fun. I still have a lot of books to finish. I don't want to go. Come on, just for a while. Relax a little. Staring at books all the time is tiring. Who knows? Maybe you'll meet someone you like. Don't be such a killjoy. Fine, but just for a bit. No getting too wild. Don't worry. We promise we won't. Let's head out now. Over here, come quick. Okay, hello. This is my friend. It's their first time here today. Welcome, welcome. Hi there. Hi, come join us. Let's all chat together. What do you like to do for fun? Black-haired male doctor. I've heard a lot about you from our department. They say your medical skills are outstanding. Are you single right now? Have you ever dated before? Yeah, I'm single. I dated once before, back in college. The singing flows through the quiet bar. The stage and tables sink into a gentle atmosphere. Long time no see. You're back? Who's this? I'm a nurse from general surgery. 1 million is Dr. Zhang's colleague. Is she your girlfriend? Did you just get back to the country? I just came back recently. Didn't expect to see you here. I wanted to chat with you more, but I have something urgent to handle. I have to go. Okay, you go ahead. Let's stay in touch. Who's she? Your ex? Nothing, just thinking about the cardiomyopathy case. Hurry up and practice. You still have to review the self-check process tomorrow. So that's how it is. I thought I could start hands-on practice right away. Calm as still water. Only then can you break the deadlock. Respond to movement with stillness. Striking later but arriving first. That's enough, that's enough. Don't worry, I've already found a new job. It's an internal energy support role. It's easy and not tiring. The salary is enough. Got it. Do your best at 5 grids. Don't worry about home. I've still got things to do here. I'll hang up for now. Sending money to uncle again? Your filial piety is truly unparalleled. Just now, Brother Wu said the self-assessment will take 2 days. Today is the martial arts insights speech. Tomorrow is the practical combat skills assessment. Okay, got it. Now please welcome the first speaker, the close combat martial artist. His speech is titled, Born for Martial Arts. Martial Mastery Achieved. Thanks to Jiang Tong for the wonderful speech. Next, let's welcome the second speaker for internal energy guidance. Lunch break. In a remote martial arts village, there was a young martial artist. He was born with a strong physique, but his mental strength was weak. Over time, his mental strength became chaotic. His internal energy went out of control. He became known in the village as the berserker. Eventually, during a complete loss of internal energy,
He hurt the father who had always taken care of him.
well done. Your speech not only showed your insights into martial arts, but also held true to the original heart of martial arts. Keep up the good work for tomorrow's practical assessment. Lunch break for this round of insight speeches. After the jury's strict calculation, the highest and lowest scores for each contestant are removed. The average is taken as the final score. Now I will announce the list of winners. First place goes to the advanced martial artist returned from overseas, scored 97 points. Second place, the young man in martial attire, scored 96 points. Congratulations to both martial artists. Also, thanks to all contestants for sharing so sincerely. What you said about the martial artist's heart is 100 times deeper than his empty theories. In empathy and practical insight, you far surpass him. This task for you is really unfair. Chief, I am already satisfied. That martial artist returned from overseas does have things I can learn from. With this mindset, you have nothing to fear about breaking through to advanced level for tomorrow's combat skills assessment. I believe you can definitely take first place. Make up for today's regret. I must work even harder. One day I will surpass him. Let everyone see my strength. Brother Feng, you've gone viral. The official Whoosh A account posted your morning speech video, and it's only been a few hours. Over 400,000 likes in the comments. Martial artist's heart, so deep and insightful. I just sincerely shared my insights into martial arts. That's all. I didn't expect so much recognition. By sharing insight into spiritual power, guided thoughts related to the martial artist's heart, Spread positive energy in martial arts. Influenced many other martial artists. Rewards have been issued to your secondary account. Please check. Turns out it's not just about cultivation. Completing system trials really brings unexpected gains. I should do more of this in the future. It helps other martial artists and helps myself improve. A win-win situation. Brother Feng, what's up with you? Why are you smiling so happily? Another good thing happened? Nothing. The system just gave me a little reward. I didn't expect sharing martial arts insights would also get acknowledged by the system. Dad is so lucky. Let's share more insights from now on. Spread the martial arts spirit more. Not only builds our reputation, but also brings rewards. That's simply awesome. Here they come. Who is it? Ahahaha. Hey, your son is famous now. The Wuje official account posted his speech. It's gotten over 400,000 likes already. The whole county is praising you for raising such a good son. Uh... Hey, I knew my son was capable. He's always been a good kid since young. And now see? You say now he's so competent. Isn't it time to find him a wife? Stop worrying about that. Your son is young and capable, and an advanced martial artist, and handsome too. It's not hard to find a wife for him. There are plenty of girls after him. Just enjoy the good life. Hmm. Tomorrow's practical exam is stitching grid. No need to worry about the fighting skills. But this heart vessel refinement is the key for me to break through as an advanced martial artist. I must spend more time perfecting it, mastering every detail. Simulation trial start. Heart vessel internal energy extraction. The core challenge of heart vessel refinement is acquiring a suitable internal energy source. Due to the traditional concept in the martial arts world of internal absorption only, not giving away energy, most martial artists feel it's better to receive than give, helping others break through heart vessel barriers. I understand that more than 2,000 years of Chinese feudal history have made martial artists deeply value inner completeness. The idea of not showing one's heart outward is deeply rooted.
This
Is indeed the biggest obstacle to popularizing heart vessel refinement. Times are changing. The new generation of young martial artists is more open-minded, no longer bound by the old tradition of internal absorption, helping those whose heart vessels are damaged. This is exactly what it means to have the martial artist's heart. So the continuation of martial arts is not just a breakthrough in self-cultivation, not just the passing down of techniques. This is the true martial artist's heart, and what I've always sought. Uh, After a night of practice, my grasp of heart vessel refinement has deepened. I'm more confident in tomorrow's sparring assessment. Uh, H, H, H. You look energetic. You must have practiced hard last night. Let's do our best in today's practical exam. Give it our all. All right, let's go for it together. Don't waste your efforts. Stay true to your original intent. H, H. Energy loss is slower than expected. Good thing I made it in time for optimal extraction. Sever the energy link between the core and the body. No margin for error. Advanced Beast Core Extraction Technique. Operation completed from start to finish. 0 mistakes, proficiency increased by 15 points. Note: 100 spirit energy points awarded. Finally achieved 0 mistakes. This feeling of power growth is better than anything. Maybe he's just too aggressive. It's not what I want. Recently, a lot of martial artists have gotten anxious in training, resulting in disrupted breathing and unstable spirit energy. Be careful during patrols. Handle abnormalities as soon as possible. Yes, in any case, yes. Anyway, yes, anyway, yes. Young man in black with short hair. Thank you for saving me last time. If it weren't for you fixing my meridians after the mistake, I would probably be left with lasting injuries this time. You're recovering well. Keep it up. Don't rush the process. Thank you for your concern, Chief Steward. I'll be careful. Anyway, his energy drainage has already decreased. Vital signs are stable. Currently, occasional meridian swelling and pain still occur.
Ming.
Work well with the treatment. You'll be able to recover and start training again soon. This chaotic spiritual energy is way too intense. It's honestly unbearable. How do we handle this situation? It should be about suppressing the chaotic spiritual energy first, then take a detoxifying pill. But what if the detoxifying pill puts too much strain on the meridians and ends up damaging them? The patient's spiritual energy concentration has already reached 43 mol, far beyond the critical threshold of 11 mol. Immediate guidance is necessary. Otherwise, it'll cause a spiritual energy rampage. Meridian rupture. Extract spiritual vein fluid. Bring another bottle of purity pill. Spiritual rhythm grass, condensation flower, and jade dew. Bring them here. Did you see that? You call that tough guidance. This is what real guidance looks like. The purity pill promotes spiritual energy metabolism. Herbs and flower pollen help purify the spiritual energy. Repair the meridians. You need to study hard from them in the future. Good job. Well done. The black-clad, short-haired youth. Let me tell you, you'll definitely get top 3 in this practical assessment. Maybe you'll even win first place. Zhang Hua is right. Our Zhang Feng is just that good. He's bound to take first place. No one can beat him. Imperial Army direct gaze. Are you treating the guy in black as your cultivation partner now? Right? They're so close. Looks like something's about to happen. The black-clad youth has hidden depths. When did you get together with a cultivation partner? Why didn't you tell me? I hope you stop letting everyone misunderstand our relationship. The other day I didn't refuse, because I didn't want to embarrass you. If my silence led you to think I agreed, then I apologize. We're not even close. And honestly, I'm not interested in you at all. All right. Let's not all just stand around here. The assessment's about to begin. Let's head in first. This in-house self-assessment has 2 main goals. First, selecting competitors for exchanges with other martial halls. Second, offering everyone an opportunity to spar during lunchtime, so you can learn from each other's strengths. The main focus this time is spiritual energy suturing. Whether healing yourself or supporting a teammate, or repairing spiritual tools, it all depends on this skill. As for what you'll suture, contestants will draw lots on site to decide. Give it your all, everyone. Show your real abilities. The difficulty depends entirely on the material. Each one has totally different vein distribution and toughness. The gap is huge. It'd be bad to draw a tough one. Yeah, heard the director prepared some really challenging materials, just to test everyone's ability to adapt on the spot. Do you think you can handle it? If you draw the hardest spiritual vein suturing object, that's going to be rough. I can handle it. Assessment begins. Contestant number 1, please. Short-haired black armor, your turn to draw. The black-clad, short-haired guy, here's your suturing material. Assessment complete. Judges, please give your comments. Aggressive control with stability. Neat suture patterns. That's seriously impressive. Should definitely take first. Next contestant, please. The black-clad youth goes to draw. He's smiling. Did he get an easy one? Why is he smiling? Did he get lucky with the lot? Well, he's so strong anyway. No matter what he gets, he'll probably be fine. Material for this round: spirit goose egg. Spirit goose egg. That's one of the hardest materials to suture. The goose egg's outer shell is hard as spirit iron. The inner membrane is as thin as a cicada's wing, and it's covered in fragile spiritual veins. Even a little carelessness, and it's ruined. Director, this is way too tough. Isn't this pushing it too far? Why is this round so unexpected? That's the point of this assessment. To catch you off guard. Strike when you least expect it. Testing real spiritual power. Precision and adaptability under pressure. That's how you pick the best candidate for exchanges. He's an advanced fighter. I believe he can handle it. Definitely. What's he doing? Why is he cutting open the membrane? Is he reinforcing the shell first before suturing? That's amazing. Black-clad youth. You're seriously awesome. Nice work, black-haired youth. Advanced beast core extraction technique. 0 mistakes throughout the process. Skill increased by 15 points. Bonus: 100 spiritual energy points. Finally achieved 0 mistakes. This feeling of getting stronger is better than anything. Maybe he's just too proactive. This isn't what I want. Recently, many martial artists have been experiencing spiritual blockages from rushing their training. Chaotic spiritual energy. Be extra vigilant during patrols. Handle any irregularities immediately. Yes, absolutely. Yes. Absolutely. Yes, that's right. The black-clad, short-haired youth. Thanks for saving me last time. If you hadn't loosened my spiritual blockages and repaired my meridians, I might have ended up with lasting problems. It was nothing. Focus on your training. Just remember to keep a steady pace going forward. You've recovered well. Keep it up. Don't rush it. Thanks for caring, Chief Steward. I'll be sure to. Bottom line, his energy drainage is already down. Vital signs are stable. Currently, occasional meridian swelling and pain still occur. Go Ming. Work well with the treatment. You'll be able to recover and start training again soon. I can teach you, but not for free. The deep blue suit youth? I know you're really skilled, but I don't get much from my training allowance. Plus, I still have to pay my mortgage on my little place. I really can't offer you much in snacks or training resources. I just heard top-level spiritualist Wang Xinling is coming to Suzhou for a spiritual rhythm concert next month. If you get me a ticket, we'll call it even. How about that? No problem, I've got you covered. It's just a concert ticket, right? I'll get you one for sure. Everyone, all contestants have finished this practical assessment. Now I'll announce the results. Assessment begins. Third place, 92 points.
Close combat lunchtime group.
Thank you all. I knew he'd take first place. Now I'll announce the combined scores for the two-day assessment. First place, 190 points in total. The deep blue suit youth. Second place, 188 points. Left side, black armored guy, blue suited youth. Right side, black armored guy. The three of them will represent our martial hall at the National Martial Artists Exchange Competition. The champion of this event is Didn't expect you to be this outstanding. Looks like all these years of liking you were worth it. First, I want to
praise to all the contestants. Everyone gave it their all. You all showed your true abilities. There's also some good news to announce. Why is the woman with long black hair here? I understand. Remember the procedure. No mistakes allowed. Yes. When I saw the new director just now, why were you so shocked? Do you know him? We were classmates before, but not very close. Turns out she graduated from a top overseas dance academy, and she's an advanced dance practitioner. She's holding such a high position at such a young age. Her aura is so cool and aloof. She's practically the goddess of the dance world. Now, let's invite the woman with black hair to introduce herself. Hello, everyone. Starting today, I'll serve as Deputy Director of the Martial Arts Emergency Team. I graduated from the Stanford Martial Arts Academy, majoring in Advanced Emergency Care and Meridian Recovery. I look forward to working with you all. She clearly could have gone to a more prestigious martial arts gym. Why did she choose Shujo Martial Arts Hall? Is she here for me on purpose? I'm here. Wait for me? At the time, he was wondering who it was. That black-haired boy is incredible. Perfect score on the exam. He was even selected for the national exchange competition. We have to celebrate. I'll treat everyone today. Using my cultivation allowance, I'm treating the whole team to a meal at Lingen restaurant. No one goes home sober tonight? All right? Cheers to today's victory banquet. This wine is amazing. Have another glass? Sure, everybody together. Hey, a short-haired boy. Thanks to you this time, our executive team finally regained some pride. Let me toast you. I wish you even greater success at the national exchange competition. Ha ha ha. Thank you, Deacon Zhao. I'll do my best. I can't really drink much. It's okay. Just have a little. Yeah, right. Fine. Just this one glass, hey. So? Unlucky? It's way too dangerous for good-looking guys to go out these days. Too much spirit wine, and my head feels like it's going to explode. I'm never drinking this much again. Could you carry him back to the Meridian dorm? Be careful on the way. Don't worry, I'll make sure he gets back safe. Then I leave it to you. Leave it to me. In this project, we need to retain part of the original beast core fragments to stabilize the artificial body spirit core auxiliaries. Currently, the martial practitioners who've received transplants have an average cultivation survival period of up to 13 years. In this project, we need to retain part of the original beast core fragments to stabilize the artificial body spirit core. This assists with beast body meridian adaptation and lowers rejection rates. Spirit core transplants are the last resort for martial artists with late-stage meridian exhaustion or serious core damage. Currently, the martial practitioners who've received transplants have an average cultivation survival period of up to 13 years. Director, about that short-haired boy? He excels at physical refinement and energy channeling. He'd be a great fit for our melee team. With him, we'd have a shot at winning the national exchange competition. We could definitely get a good result. No way, the meridian guidance ability of the boy in white is extremely strong. Our meridian recovery team badly needs someone like him. With him in our group, our meridian recovery efficiency could increase by more than half. He needs to join our team. Team leaders, stop fighting. His spirit power precision is really high. Great with anything related to artifact repair and control. If he joins our logistics team, it'll greatly boost our artifact maintenance and repair quality. It'll bring out his strengths even more. His suggestion is way too risky. We can't act rashly, but time is tight. We must get the Bureau involved. We can't afford the consequences. Unacceptable. You don't understand the situation at all. We have to stick to our principles. Principles? You're too emotional. Then what's your plan? Do it my way. Otherwise, just keep quiet. Who do you think you are? Sorry. Team leaders? We're assigning Zhongfeng to our emergency team. Deputy Director Shan, isn't that a bit unfair? Zhongfeng is best at physical reinforcement and meridian guidance. That doesn't have much to do with emergency work. He'd fit much better in our surgical group, not the emergency team. Team leaders, I know you all value Zhongfeng's abilities, but the crisis in the emergency team right now is far worse than you think. When the emergency team's deputy director left, several experienced emergency specialists went with them. For sudden and severe meridian injuries or critical training accidents, we're now really stretched thin. I've already confirmed with HR that all the other martial arts teams have enough advanced practitioners. Only our emergency group is desperately short-staffed. We urgently need someone like Zhongfeng, a top-level practitioner who can operate independently. The woman with long black hair is right. The emergency team is definitely under intense pressure lately. We badly need new support. I suggest we temporarily transfer Zhongfeng to the emergency team to help relieve the shortage. That's not okay. Zhongfeng's meridian guidance ability is way too important for our group. We can't transfer him to the emergency team. How about I send another mid-level practitioner to help the emergency team? And keep Zhongfeng with us? Is your other practitioner as good as Zhongfeng? If not, then forget it. Team Leader A, even you don't want that person. How can you force them on our emergency team? If our emergency team misses a critical case, who's responsible? All right, enough arguing. It's settled. The boy in white will go help the emergency team for now. Once we've hired enough staff, we'll adjust his assignment based on his wishes and each team's needs. What the heck? Zhongfeng's being transferred? That's way out of line. How could something this big happen with nobody telling me? Zhongfeng is a vital member of our executive team. How can you just transfer him like that? Hey, black-haired kid. I just got word from the director. You're being reassigned to the emergency team. What? Huh? Recently, the emergency team lost a deputy director who took quite a few outstanding Experienced emergency specialists, away with them. I don't want you transferred either. I hate to lose such a great assistant. But if it's the director's decision, there must be a good reason. You go report to the emergency team and get familiar with their daily work. Thank you, Deacon Xiao. I'll get ready. That new person had barely arrived at the gym, and I'm already being transferred to the emergency team. This can't be a coincidence. What are you spacing out for? The transfer order is here. You're joining the ER. This is a good thing. The ER is busy, but you get exposure to more emergency cases. It's good for improving your martial skills. I didn't expect to be sent to the ER. Oh, it's Deputy Director Shan. Wait, you two know each other? Yeah. We were classmates in college. We even dated. I have a feeling this whole transfer was arranged by her, whether he arranged it or not. This is a great opportunity. You've been apart for so many years. Getting to work together again is a kind of fate too. Don't overthink it. Just do your best. Your talent will shine anywhere. Got it? Thank you. You. Finally added me. After all these years, I finally waited for you. Is it really that important? Why not think about the reason? How could he not know the reason? He understood his feelings for her since college. But back then, he had nothing. He couldn't even master the basic martial healing techniques. So he broke up first out of insecurity. Now he has support. Martial arts medicine is thriving. He's no longer the penniless student he used to be. He thought about it. Stop spacing out. Come with me to check on the patient. An elderly lady was just transferred to the ICU. Her condition is quite serious. She was transferred from cardiology to cardiothoracic surgery. But in the end, she was sent here to us. All right, let's go take a look. By the way, what's the patient's situation? The cardiothoracic doctor said she has rheumatic heart disease, which turned into 5 blocked qi and blood conditions. The elderly lady practiced low-tier martial arts when she was young. Years of practice damaged her meridians, and her qi and blood circulation is poor. She was treated in cardiology for over half a month. Qi and blood guiding therapy didn't work. Transferred to cardiothoracic, but surgery wasn't possible. So she was sent to our ICU. Understood. Let's first check the patient's qi, blood, and meridian status. We can't be careless. I sensed it. In cardiology, they mainly did dual qi and blood therapy, used anti-inflammatory runes and soothing medicines. But there was no effect. We need to reassess the treatment plan. Originally, we wanted to do a meridian repair surgery,